Wow, that made a difference in light. Welcome back, everyone. So I've been recovering from this this TOS surgery that I had. I've got these cool scars right there, and I don't know if you can see it, but this right here is it's as hard as a rock. That's a muscle spasm. I've been trying to get it under control for a while, but it's been a battle. So I'm trying to make goals for myself every day. Having a chronic pain condition makes it really hard to get anything done. It's not that you don't have any motivation. You have motivation, but you just don't have the energy to actually get up and do anything. So you'll want to do something, but you're just like, oh my God, I'm so exhausted. I'm in pain all the time. Fuck. The condition really, I mean, it sucks. If you can avoid becoming a chronic pain patient, avoid it at all costs. Try your best to never become a chronic pain patient, especially like nerve pain and like with like body damage. There's some things you can't avoid, like just growing older, your body falls apart. But don't do things that damage your body. Listen to your body. If it's telling you like the work that you're doing is hurting, listen to your body and pace yourself. There is no company out there that is worth damaging your body for. None. It isn't worth it. You only get one body. There's plenty of employers. Don't do it. So I've been making small goals for myself and saying, okay, I'm gonna get this done this day. I'm gonna get this done that day. And this actually making a video wasn't in a plan for today, but I was like, you know what? I got some time. I'm gonna get it done. I'm gonna do one. Talk about this TOS thing. So I have neurogenic TOS or thoracic outlet syndrome. There's two other types. There's arterial TOS and venous TOS. Usually people who have TOS will have slight components of another version of TOS. So that's very common. Somebody with arterial TOS, which is the compression of the artery, might have symptoms of neurogenic TOS, like what I have. All of it passes through the thoracic outlet. Your thoracic outlet, the brachial plexus, is comprised of a nerve bundle, your main artery, and your main vein to your arm. Mine is on my right side. I'm unilateral. Some people are bilateral, meaning they got it on both sides. I feel really bad for those people. That must be fucking hell. So they did the surgery, and in the surgery, I have to try and give this some breathing air. It's really sensitive, real touchy. So when I went into surgery, my dad talked to the surgeon afterwards, and And I asked him, what did he say? And he said, oh, I don't remember. He just gave me a bunch of medical mumbo jumbo. And I was like, do you happen to remember any of this quote unquote medical mumbo jumbo? And he said no. And I was like, God damn it, that shit was important. I needed to know what that was. But that's okay. I ended up reading the doctor's notes, the surgeon's notes anyway. So this is what was going on inside my body. This textbook neurogenic thoracic outlet syndrome. So I had 5 nerves being compressed, not just one. I had 5 nerves. The root nerves that come out of the vertebrae from C5 all the way to T1 were all being compressed instantaneously coming out of the vertebrae by scar tissue. In fact, I think the surgeon himself was pretty, not impressed, but kind of in like bewilderment of somebody who wasn't an athlete having that much scar tissue. And I think people that I've talked to have severely underestimated how physical the job was that I had working in the warehouse. It was extremely physical, very detrimental to the body, but tons of scar tissue. He had to spend a lot of time, according to the notes, removing scar tissue and basically, rewiring my nerves is what my primary care physician called it. He's not literally rewiring, but he had to replace, like he had to put the nerves in different spots that they were setting in because of all the compression they were getting. So there was a ton of scar tissue. And then there were like 3 nerves that were compressed here. 3 nerves and the main vein that runs through the thoracic outlet were being compressed by the scalene muscles in my neck. And so I think he removed the middle scalene muscle and the far back scale. You have like 3 of them. You have the first one, a middle one, and one behind that. So I think he removed the middle one and the back one and left the front one. So the three nerves and the main vein were being compressed by the scalene muscles in my neck. So I had 2 scalene muscles in my neck removed. You can't remove all of them because your scalene muscles help you breathe. Originally, they were going to leave my first rib intact. No sense in removing something if it's not doing anything. But unfortunately, one of the nerves, I think the root nerve, what they call the ulnar nerve or something like that, was being compressed by my first rib. And it was being compressed like towards the back of the rib. So unfortunately, they can't just remove part of it. They have to remove the whole thing. So my first rib was also removed. And then they did what's called a pec minor release. That's where they detach your pectoral muscle from your shoulder. And when he did that, he discovered that my pec minor, my pectoral muscle, was crushing my main artery to my arm. So I'm really glad that got done. A lot of TOS surgeons do not do all 3 surgeries in one. Most of the time with neurogenic TOS, they do the first rib removal and the scalene removal, the scalenectomy. They'll do those, but most of them don't do the pec minor release. The particular surgeon that I saw, he's particularly known for doing the pec minor release to avoid repeat surgeries. And it's a good thing he did that because compression of the main artery can be life-threatening. It will literally just cut off the blood flow to your entire arm, and your arm will swell up and turn purple, which that's happened to me a couple times. I didn't have terrible symptoms of the arterial TOS, but he suspected that's where the symptoms I was exhibiting, where it was coming from, was the pectoral muscle. And when he was doing the surgery, he was correct. And if that hadn't have been done, then I would have had the decompression of the nerves. Um, but I would have had to find out the hard way that my artery was being compressed. And by the time your arm swells up and turns purple, you're already looking at a possible blood clot, which is life threatening. So you have to go to the ER and get that blood clot removed immediately. So my nerves, I had 5 nerves from the vertebrae C5 all the way through T1 compressed for 5 years. My shoulder right here, like up here, is numb. I could put a piece of ice right here and I can't feel it. It's like touching it. It's like there's a plastic or wax covering the skin, and the flesh doesn't actually register that I'm touching it. The end of my index finger is numb, so I think that's there's some dead nerves and nerve damage in my pointer finger. My hand opens up now. It was contracted for like several months, almost the entire year. It's been contracted. So I've got some nerve damage. I've got some dead nerves, and I've got some atrophy, some missing muscle tissue, and the contractures released when he did the nerve decompression. So now I'm just recovering from the surgery. The surgery is very, very brutal. It takes a long time to recover from the surgery. Like possibly a year or two. I think the first year is just recovering from all the stuff they did, taking your rib and your muscles out, detaching the muscle from your shoulder. Oh my God, the pain. Holy shit. I've never had a surgery before, so I guess go big or go home. When I woke up after the surgery, I felt like I had been shot in the fucking chest. I mean, I've never been shot before, but that's what I would imagine being shot in the chest to feel like is how that felt. I mean, it's so painful. Literally, I was pacing back and forth. I was in the hospital for 4 days, and at one point, I was pacing back and forth in my hospital room, and the pain was just so intense. Like I literally didn't even know what was going on. I couldn't tell you if the window, if it was possible, like if the window in the room was large enough to walk out of, I probably could have walked out the window, not because I wanted to commit suicide, just because I didn't know what I was fucking doing. The pain was just so intense. My nerves have been turning back on. I've had all kinds of very, very strange nerve sensations up and down my arm and in my hand. This is extremely sensitive. And like I said, this muscle spasm there is quite uncomfortable. And I've been putting ice on it to try and get the muscle spasm under control, try to get the inflammation to go down. And usually once I do that, then I start getting muscle cramps in my chest. I'm like, thank goodness this is on my right side, not my left side. Otherwise, I might think I was having a heart attack or something. I think it's funny. I'm in a TOS support group, and I've been having a lot of really strange dreams revolving this side of my body. Like one dream that really stands out to me and very prominent was that these two people, I don't know these people. Apparently this woman and her dad, and in my dream I knew who these people were. I don't actually know who they are. I've never met these people in my life, but in my dream I knew them, and it was this girl and her father, and she was driving this new SUV thing that she had bought, and she backed up into me and smacked me in the chest with her fucking car and pinned me between the the car and a fence, and me and her dad were yelling at her like, stop backing up, go forward, you fucking hit Chris, you you ran over him with a car. Chris is my real name if you didn't know. But so she backs up even more and knocks me down on the ground, and she comes running out. She's like, oh my god, we gotta call the ambulance, we gotta call 911. And I'm like, no, don't do that, I don't want you to get in trouble. I don't want you to get in trouble for hitting me with a car. And she's like, I understand not wanting me to get in trouble, but you just got hit by a fucking car. And I'm like, no, don't call the ambulance, don't do it. She's like, no, you got hit by a fucking car, you need to go to the hospital. And I kept trying to get them not to. They did anyway, but I went into their kitchen and threw up in the trash can in their kitchen, and wake up from the dream. But I've been having dreams where I've been hit by like several vehicles, like 3 or 4 vehicles, shot in the chest 3 or 4 times, and I dream in third person. I think that's very weird, but I dream in third person. So I've seen myself buried 3 or 4 times and cremated 3 or 4 times. And I thought, I just think it's interesting how your subconscious chooses to communicate with you through dreams. My subconscious is basically telling me like, hey, like it really hurts in that area, and I really don't like it, and fuck you for doing it. So I just kind of thought it was funny, and I posted about it, and I posted about trying to get this under control. It's like, okay, so I can use ice to make the swelling of the muscle spasm go down, but then the ice causes me to have cramps in my chest, and then so I go back to heat, and then heat causes this to swell back up and spasm again. It's like I can't win. And I wanted to see if anyone had any helpful tips on that, but everyone who commented on it wanted to comment about me taking pain medication, and that the pain medication was probably giving me nightmares. And I was trying to explain to these people, I explained to them when I made the post, I'm like, I understand most people do not dream like I do, but me dying in dreams is not that's not abnormal for me. I mean, I've pretty much have nothing but nightmares all the time, and I'm quite used to them. I mean, I even found the dreams to be funny, even though like I'm getting hit by vehicles and sometimes dying. But it's no big deal to me. That's normal. That's normal dreaming for me. It's really not that big of a deal. But everybody was fixated on it, and nobody was like, I was curious how many people after they have major surgery dream about that part of their body, and have like various things happen to them because, like that's a major surgery, that's trauma to your body, and your subconscious mind will communicate that to you. So I was just curious how many people like have done that, have dreamt about it, maybe not necessarily the way that I do, but just in general. No, everybody was like, oh my god, you're having dreams like that, it's your medications, you need to get off the medications. And everybody was making assumptions about the medications I take. I didn't even tell them what medications I was taking. I didn't even tell them. A couple people made the assumption that I was taking gabapentin, and if I was taking gabapentin, I would actually believe that gabapentin was probably the cause of having very vivid and graphic dreams, because gabapentin causes me to go into a state of hypermania and psychosis. So I can't take that kind of drug. I can't take antidepressants that are used instead of opiate pain medication. Can't take them. So I am on opiate pain medications, very, very low dose. Very low dose. very short acting, like 4 hours, 5 milligrams. That's it. It's not strong, not long acting, so it's really not that big of a deal. But the majority of the people were making the assumption that I was on opiate pain medications, and they were saying, you need to get off opiate pain medications. You need to get off opiate pain medications, just left and right. These anti-opiate zealots. And I'm still advocating for pain patients across the United States that, because not being able to tolerate things like gabapentin, Effexor, amitriptyline, are there any others? There's a medication they use for dementia and Alzheimer's that they prescribe for managing pain as well. But I can't take those, and I'm not the only one. A lot of people are very, very sensitive to those medications and can't take them. And they have to take the only option that's left is opiate pain medications. And so that really irritated and frustrated me that I had all these people being all anti-opiate and stuff. It's like, look, if opiates don't work for you and you don't want to take them, and gabapentin works for you, you know what? That's great. Actually, you're lucky. If you get pain relief from gabapentin, you can actually tolerate that kind of medication. You're lucky, because if you want a refill on that, nobody's going to question you. Nobody. If you're taking opiates for pain medication and you need a refill, they look at you like you're a dirty whore, and it kind of fucking sucks. And you'll be really screwed when you can't get any more, because when they stop prescribing it, and if you're still in pain, tough shit. Cross your fingers and pray for daylight, honey. That's all you get. Because in today's day and age with the opiate epidemic, people do not like to prescribe opiate pain medications. They don't like to do it. They think you're going to become an addict. And it's like, gabapentin's addictive. I'm not going to get into that whole debate, but it just really fucking annoyed me that everybody was like hyper focused on the content in my dream and not the context. And I was really more interested in the context, and tried to even tell them, like, look, I understand most people are going to perceive the way that I dream as being night terrors and abnormal. Maybe I need to go see a psychologist or something like that. And it's like, no. It's just normal for me. I've been dreaming that way since I was a little kid. I mean, that's normal, but I'm just a darkly inclined person. Can I not just be a darkly inclined person? Like, not everything fits into your little mold, your little box. But no, they just had to hyper focus on it. But anyway, so I've been talking to my friend Cassandra about non-binary and what that actually means. And so I'm like, I have a little bit of different perspective now on non-binary, but it's not in the sense of like the definition that I think non-binary is. When I did these 2 videos about the crux of the non-binary argument, if that was their argument, I still stand by it, but that's not what their argument is. It's something else. And so I thought, maybe I should do a video, because the argument that was presented to me is actually a lot different than what I thought it was, and I have a different thought on that, a different idea on what that is. And I thought, maybe I should make a video about that, clarifying that, because that's a different concept entirely. But I'm going to save that for a different video and not make any promises, because it seems that having this chronic pain, I don't know, maybe I will get around to making it, maybe I won't. I don't know. Like I said, when you have chronic pain, you're motivated to want to do stuff, but your get up and go just sort of got up and went. So, anything else I can tell you about, like, recovering off of this? Um, I mean, I don't know. It's just kind of crazy to think about that. Like a rib, my first rib has been taken out of my body up here, and that just kind of freaks me out. It's like that's a part of my body. Like, I grew that myself. It's just kind of weird thinking about it. So, first rib was removed, scalene muscles out of my neck were removed, and my pec muscle was detached from my shoulder. And it has been very, very difficult to sleep. I tried to sleep in my bed the first night that I got home from the hospital. I was in the hospital for 4 days, so when I got back home, I tried sleeping in a bed, and I realized that trying to lift your head up requires the muscles in your neck that are no longer there for me. So I had to roll over on my left side and then try to get my feet off of the bed. And I don't know. There was a trick to it. I was able to do it, but it was difficult because it was like, "Uh, uh, uh." I've been doing some physical therapy exercises, so now I can lift my head with my neck. But this still is really sensitive, and that makes it really hard with that that swelling, like that spasmed muscle. It's like ugh, ugh. But I've been sleeping on the couch. It was actually recommended to me in the support group that I sleep in a reclined position, as most people have a hard time after the surgery getting up, laying on your back. Another thing I've noticed is that the pectoral muscle being attached to your shoulder gives you stability in your shoulder. And so, like, I'll lay on my left side, and my arm will literally like fall in front of me or behind me. Um, Literally just fall. Like gravity is just doing what it does, and my arm is just falling in front of me or behind me, and it creates all kinds of really funky nerve sensations. Like the nerves get super pissed. I can't fully extend my arm out in front of me yet. Like it feels like the nerves are being tugged on really hard, and it's quite painful, quite uncomfortable. Been using a combination of heat and ice. So I've fallen asleep several times with a shoulder ice pack that it'll cover the across my chest if I don't use it on my shoulder. It's meant to cover your entire shoulder area, like your scapula, shoulder, and right here. But I'll undo it, and I've laid it across my chest, and I've gone to sleep with that. But I also sleep with a heat pad next to me as well. But now on the medication regimen, I'm not even taking as much pain meds as I am muscle relaxers. I've been taking like 20 to 30 milligrams of Flexeril a day, 4 milligrams of tizanidine a day, um, 2 or 3 600 milligram ibuprofens a day, and then 2 milligrams of Clonopin a day, and then like one 1 to 3 um, pain meds a day. So I think it's really funny. These people were going off on me about taking pain medicine, which they didn't even know I was on. I didn't tell them if I was on gabapentin or getting ketamine transfusions. I didn't tell them shit. They just assumed. But yeah, I am on opiate pain medication, and so that is that I've been given like the Oxycontin. So it's like 5 milligrams of pain medication, then 325 milligrams of acetaminophen. So that I'm only doing like once and max 3 times a day.
I try to just keep it at
I try to just keep it at 1 time a day, but sometimes like that the pain is just so intense. It's like I can only take them once every 4 hours. So most of what I'm taking, I'm taking more muscle relaxers than anything, because that's what the tizanidine and the Flexeril is. Those are muscle relaxers. I'm taking 3 to 4, no, 2 to 3. No, it's 3 to 4 3 to 4 Flexerils a day, and at least one tizanidine a day. So when I first started, I was doing I think 2 tizanidines a day, and 3 Flexerils. But hopefully, taking the antispasmodic muscle relaxers the idea is to get this thing under control. So far, no, it's still there. It's like, man, that thing needs to stop. But I was told that it's pretty normal after a surgery like that for some muscle spasms to happen like that. So not to worry about it. That it can take 4 months for that to go away. So that's fun. I had to be on a 20 grams of fat diet a day, because there's this weird lymph node fluid that can build up in the thoracic outlet after they do that kind of surgery. It has a name like Chyle or something like that. It's CHYLE or CHYEL, something like that. But 20 grams of fat. And what's interesting is that I didn't have to make a lot of changes to my diet. I had to cut out like cheese or something like that, but most of the things that I was eating was already, and I was shocked to see that most of what I was eating was already under 20 grams of fat per day. So that wasn't really as hard for me as it might be for a lot of people. Before I left the hospital, they were really obsessed with me pooping. They really wanted to make sure that I could poop before I left. I thought that was kind of weird, and they were like, "Well, you've been on all these sedatives and painkillers. We just want to make sure you're not constipated." I'm like, I'm not. I'm fine. Being that I only even eat once a day, I don't poop that often in the first place, but they wouldn't release me until I pooped for them. So I just I think it's weird. I think it's funny. But I did find out though, the dried fruit like dates, raisins, dried figs, and prunes have no fat in them. So I could eat as many of them as I like. And I'm like, well, if I can eat a bag of prunes a day, I don't think I have to worry about being constipated. I think I'll be fine. I'll be all right. So that's been my little journey lately, is recovering from that surgery, which, like I said, it's been brutal. I've on the numb spots. I've also got one on my bicep, on the underside of my bicep. There's this spot where I could just sit there and rub it, and it too feels like it's got like plastic covering the skin, like I can't actually touch it or feel it. So other than that, like um the nerve sensations are really really hard to describe. they're not like anything I've ever felt before. Um, a lot of them are indescribable. Um, some of them are. Some of them, like I've been having like the sensation of being electrocuted in my fingers. Not like a taser, like where you're being shocked, like that's painful. Like if you actually get electrocuted, it's this weird vibrating sensation, and I get that in my fingers. Sometimes I'll feel like I've been hitting the funny bone, and but the rest of the nerve sensations, they're indescribable. I don't know anything else that feels like that. It's strange, really strange sensation, really strange. And then, of course, there's this, which is muscle and bone pain. That sucks. For some reason, like your scapula will hurt after the surgery. Like my scapula, which is your shoulder blade, it feels like somebody put like a tube of plastic like underneath my skin, like right under the bone, like just to mess with the muscles, and so it's like really uncomfortable. Um, I don't know why that is, but scapula pain is common after the surgery. That's common, and so hopefully after the 4 month mark, I'll be in much less pain than I am now, and that the pain of because the thing about the surgery, it does not cure neurogenic TOS. It doesn't cure it. It just stopped the degeneration of my arm. It stopped the atrophy and the contractures. I still have neurogenic TOS, but like my hand is opened up now. It's not contracted anymore. Maybe you can kind of see this. It's really prominent here in this ring finger. How skinny that thing is. It's just lost a lot of muscle tissue. I've lost some muscle tissue in the palm of my hand, and it's really weird. When the nerves are like super active, I can run my hand under some cold water, and I'll just have all these red splotches everywhere, all over my hand because from nerves. And if the nerves go quiet, you can. I figured out that heat stimulates nerves, so like I tried putting heat on the numbness on my shoulders, seeing if I could get the nerves active. And like I said, that irritated the muscle spasm. I'm like, fuck. But that's what I've been dealing with. I'm gonna try to get to making a video about this new understanding of the non-binary argument, and I also want to get to making a video about the commentary that was made on the last philosophical video that I made. I'm actually going to tell you how you can debunk that argument, and it wasn't really meant to be as political as it was made to be, I guess. But anyway, so I'm going to leave it there. It's been a long video, just explaining the neurogenic thoracic outlet syndrome surgery that I had. The comment section is below. You guys know where that is. I'm just going to put this up as a people blog. Anyway, yeah, like, share, subscribe, comment, hit the bell button, yada, yada, yada. And that I'm out.